Yeah, sure.
The purpose or like the whole thing?
Purpose.
The turf.
Purpose.
Yeah, turf toe purpose.
The turf toe taping procedure is used to prevent excessive extension or flexion by stabilizing the hallux or the big toe in all directions, thus reducing the amount of pain caused by extraneous movements.
Okay. Oh, sorry, go ahead.
This taping procedure can also be altered to prevent flexion or abduction of the big toe.
Okay. So, has anybody heard of a turf toe and what that is? Anybody not know what that is?
I'm not familiar.
No. Okay. So, what turf toe is? Back in the day, which has been forever in the day when Shaq played, there was a time where he was out for like a long time. Because what was happening is this joint right here, this where the toe pivots, where these long bones come in with the toe here, this joint got sprained. And because of, you think about people that might be someone that has a flimsy shoe, a wrestler, a football player that's in a 4-point or 3-point stance, whatever, maybe a gymnast or a dancer that's they don't have really any support, you know, where they get into that excessive motion, okay? And so what happens is just a breakdown of time, just constant, you know, wear on that joint, you might just get that inflamed, okay? Or something happened, an injury happened where just their toe got forced into that motion, stretched out that capsule, those ligaments a little bit beyond what it should be, okay? So if you think about this, when you walk, you go from your heel to your toe, correct? So every time you strike here, you roll forward, and then what does that do to your toe? Pulls it back, right? So can you imagine how this will feel every time you take a step?
Sure.
Now imagine if you're running. Greater the force, okay? So what we're trying to do, you could have it where it hurt to bring it down, but I don't really think I've ever seen that. I've seen it where a kid got his toe tucked underneath him, but he had like a Liz Frank fracture, kind of like that with Taysom, yeah. But this kid, I knew he got his foot turned underneath him, and then that's what got him, but his ended up being more of a Liz Frank fracture, okay? So what we're going to do is I'm going to dictate to you the injury hurts to go into extension, okay? So write that down. Injury into extension is what hurts. So we're trying to prevent that motion or limit that motion. Injury is with extension of the toe, big toe. So then that clarifies the injury and how we're going to tape this, okay? Okay, you tell me when you guys are ready. Okay, go ahead and read for me the taping procedures. Anybody? Spray, cross that off. We're not doing it. Just cross number 1 off.
Apply an anchor using 2-inch conform or 1.5-inch white tape around the base of the toe, forefoot.
Okay, I'm going to modify this a little bit. What we're going to do is we're going to pre-wrap. If it says optional, if it says anything about pre-wrap optional, it's not. It's just you have to do it, okay? So does it say optional pre-wrap?
Yeah.
So cross it off. Everybody will do pre-wrap, okay? So what we're going to do is I'm going to go around the arch of the foot right here. I'm going to go twice, and I'm going to go around the toe. I'm going to do like a figure 8 around the toe. Okay? And the only reason why I'm doing that, in case someone has hairy toes, we're going to cover it, keep their or on top, okay? I'd normally anchor this to the skin because obviously if I want to prevent that motion, I don't want this to slide, right? So you don't have to do that in here, but in the real world, I'd probably come back here a little bit more and then make sure there's more tape on the skin, okay? I'll just do a little bit on her. And I'm going to overlap it by about half or so, okay? So that's how it looks. Can I have that one that has half? Yep, that one right there.
I thought there were two separate ones.
Okay, so what I'm going to do now is I'm going to take this one, and now we're going to add an anchor to this toe. Sylvia, can you throw your other foot up here? Okay, so we got to remember this is the joint that's injured, okay, sprained. So we want to take care of this joint. So we're going to put the tape kind of around this joint right here, because what I've seen people do is they'll get it and they'll try and pull this knuckle down, and they'll get that toe. So now they're pulling down, but it's affecting this joint versus this joint, okay? So when I put that tape, I'm going to kind of go across that knuckle, and then we'll go here. And all we're trying to do is just get something so that the tape that we are going to be doing will anchor to the toe, okay? So that's 2 strips in the arch. We do 1 on the toe, and then I want to pull off. These are going to call it spicas or figure 8s. What does it say in there?
for your figure eights or the big toe.
Yep, there you go. So when I do this, I'm gonna place this here, but when I do this, I don't wanna get down too far where it gets down in the webbing and the edge of the tape and then wanna cut, you know? Everybody knows what it's like to have something down there. So just find a happy medium, but what I wanna do is I'm here and I'm gonna have her relax her toe because it hurts to come up, so I wanna pull her toe down into extension, or into flexion, okay? And then I'm just gonna take this one and I'm just gonna let it lay up here, okay? Now the key thing I want you guys to remember, I want these, when you do this, these ends need to meet up to these anchors right here, okay? So if you're not doing that, then you need to pull longer anchors. These figure eights are the spicas, okay? So 2 anchors, anchor, and then when you do your figure eights or spicas, the ends need to land up here on the anchor so that, because if these don't stick, that toe's just gonna come right up, okay? Make sense? And just have them relax their toe a little bit and you kind of pull them down.
It feels so weird.
It does. And this is where it can be difficult, where I say sometimes people will anchor around the toe and then they'll end up buckling that toe, so it's like this. So instead of getting the joint, this joint down here, they'll get this joint and then they'll pull it down like that, and then they're walking on the end of their toe. Okay? So I have seen that, so be careful when you're doing that. So we're gonna do 3 of these spicas or figure eights. And I just let these lay the way they want to lay, okay? So once I've done that, I'm gonna have her pull her up here, okay? And then what I'm gonna do is I'm gonna come from here, and I'm gonna do strips. These are called fill-in strips, I think is what they call them. What do they call them?
1 inch wash.
6. Wide inch tape should be affixed to anchor around the toe and extended straight to the down the metaphalangeal joint to the lower. So we're just going to go here straight down. And all this is doing is we're just trying to create, we're just trying to reinforce, what if I can get a hold of this thing? We're just going to try and reinforce this, what we've just done, okay? Don't wrap it up on top of the toe, just have it up a good portion of the toe, but not all the way over it. And then what I'm going to do is I'm going to come so I'm up to the top of the toe. 3/4 of the way up to all the way. Just the casting. I guess I call it casting. However you want to word it. Okay? We're just trying to reinforce all we've done, okay? And then what we're going to do is we're going to go back through, and because of all these loose ends, now we want to tie these all down, okay? The other thing you need to kind of be considerate of is, you know, the blood circulation. You go too tight around the toe, what's going to happen? You run that into maybe cutting off some of that circulation. So always be aware of that. So now I've done this. Now I'm going to need to come back here and anchor all this stuff down. Okay. Okay, so now what I'm hoping out of the situation, if I've got it anchored to the skin, so when she takes her step, it's not going to want to go as high, okay? Step down, Sylvia, and to take a step. I want everybody to step and just take at least one. It'll probably loosen up too. It'll take a second to loosen up. Just go and walk. Just try and walk normal. And so it's just going to prevent her from going that far extreme. Now listen, if a person can't walk, if a person can't walk and perform their duties with this tape job on, do you think they're gonna practice? No. So there has to be a rhyme and a reason, okay? I'm not gonna lie. So now if you're the end of the season and it's like you're nationals or you're going to nationals, would I do everything I could to allow you to do it? You dang right I would. I don't care what we have to do, as long as it is a safe manner, we're not gonna cause long-term effects to you, then yeah, I'm gonna do whatever I can. You know, but everything has to have a rhyme and a reason. But if it's going to affect you long term, then no, it's that risk reward is not there. So, but you know, you'll do whatever you can. It's a grind. As the season goes on, it's a grind. Your body starts breaking down when you're playing sports, and at the end of the year, you're getting the best that's out there. So it's tougher competition. So you got to do what you got to do, but you got to be smart doing that. Okay. So this one right here. To prevent stuff, they might put them in a walking shoe, they might put them in a boot if that's so lit. Sometimes they'll eject that joint. So, different things like that you can do, okay? Let's go ahead and hop back up there and we'll take it all off. Do I need to retape this in again, or is everybody comfortable with that?